It is Monday, and I am on my way to pick up my husband from work. He has a doctor's appointment. Um, Kind of like a pre-op thing. He has to have surgery. He has to have hip replacement. So I'll try to document some of that for you. I wasn't going to at first, but there may be, well, I won't say that there may be. There are a lot of people having hip replacements and knee replacements at young ages. So we're not young, we're kind of like we're middle aged, but younger and younger, because you used to think that was like people in their 70s or late 60s and in their 80s even, but people are having hip replacement and knee replacements and stuff like that earlier and earlier. So I want to try to document some of this for you, let you know the ins and outs of it, pre-op, also during like operation time and post-operation, so that if any of you guys are going through that or have a loved one that's going through that, maybe this can help you some. So all right, on my way to pick him up. Okay, there's hubby up there. I don't know if you can see him, he's walking. What am I trying to hurry up and finish doing? Eating. But I'm finna go in. He's going to get registered, so I'm right behind. Hey, mister.
Hi, Tracy. How are you?
I'm good. We are here for training for hip replacement surgery. And so we'll learn what to do pre-op, during surgery, and after surgery, you'll see. So yeah, we're at the hospital. I know I said earlier we were going to a doctor's appointment, but we're at a class actually. So I don't know if I'll be able to film any of the actual presentation, probably not, but afterwards I'll let you know what it was about.
You going to get you
So
something?
we're leaving now. No, I don't want anything.
Ooh, somebody going home with their reacher and all their stuff.
Yeah. This morning on surgery, so we're getting ready to roll out. Now I want last minute stuff in. I've already taken Isaiah. Well, Chris has taken Isaiah down to the neighbors. Our neighbor has a son that's a grade ahead of Isaiah. So, anyway, see you at the hospital. I always have this thing pointed wrong. Oh, on our way into the hospital. Feeling all right, mister?
Yeah, I'm fine. A little anxious, but I'm fine.
A little anxious. Everything gonna be all right. Okay, so Chris has been taken back for surgery, and I had to come out to the car. He has to get his, I guess they have to use the CPAP to help put him to sleep. I don't know, but they told me to go get a CPAP machine. So I'm going to the car to get that. So we've already prayed and anointed the doctor's hands. Not personally, but we prayed for anointing for his hands and for everything to go well for the surgery. And I'll go back and be with him shortly. He's intense. Taking him for surgery early. I guess they got finished with the other person early, but he's going to surgery right away instead of at 9 o'clock this morning. So getting ready to go to the OR. Not in a lot of pain this morning in his hip. So that's a good thing. Probably adrenaline maybe running high a little bit. But see you after surgery. Okay, so Chris was just taken back to surgery, and I don't want my mind on surgery, so of course I'm going to yeah. I better hurry up because the doctor is going to have a consultation with me right after surgery, so I'm going to hurry up and eat and get back up to surgery. Okay, I'm back in the elevators now. The breakfast was so good, so definitely got my mind off surgery. On my way back upstairs to surgery because the doctor has consultation with the family, so I don't want to miss that. And it's kind of warm in here. I'm sorry, I had brought all these layers and jackets and stuff, and it's kind of warm in here. It's not usually for a hospital. Okay, so I'm on my way to his room. They finally assigned him a room. Surgery took longer than we thought. I was waiting for a long time. And they finally, well, I'd gone to the desk, the information desk, to see what was taking so long for surgery. And the doctor finally came out, and his bones were so hard, and he said that that was a good thing. He has the bones of a 25-year-old. He said his bones were like marble. So it took them a while to cut through his bones. So I'm up here now. I'm going to his room. They finally assigned him his room. He was in recovery and was asking for me, and they usually don't let people go back, but they let me go back to see him, and so now we're about to get in the room. So I'm in his room, but he's not here yet. They had to take him up patient elevator, so I'm waiting for him. So he has a very nice room. And the patient is here. I just brought him up from recovery. So, all settled in. His nurse is going to come in soon. First meal after surgery. Jello.
Not cherry, but red.
Red. Best thing you ever ate. This is really different from years ago. The hip replacement surgery. They used to wait a while to get you up.
Oh, yeah, nope.
But I was getting up on the first day.
Probably not. Hey, usually wait. All right. So we're gonna sit up towards Kim. I'm gonna have you do as much as you can. Good. Look at you.
Look at you.
Oh my goodness.
That's what my daughter and me say all the
Yeah,
time.
our daughter says it all the time. Look at you.
The one that just went off to college?
Uh-huh.
Oh, I better not walk too far away from you.
No, please
Because I got
don't.
your golden purse.
Oh, wow.
Mm-hmm. Oh, yeah. Just might not feel very good, that ID in there.
Right.
But you're allowed to. Okay. Is your bed at home higher than this? Or about this height?
It's higher.
Higher?
How you feel?
Oh, I just got it.
Oh. You scared
I was
me.
going to say, tell us if you need the bucket.
No.
That was an interesting bird.
Mm-hmm. Looks like it was in pain at first or something.
Try
Or
to get it up.
something was stuck. Hold on.
Here, let's move these.
You are a fall risk.
That's the reason of the lovely yellow bracelet and yellow socks. Okay.
Oh,
Oh, oh. The body is shifting, getting all that
That's good.
air out.
Gotta get all that out.
mm.
And just kind of stand
Oh.
for a minute. Nice deep breaths, okay? There we go. We're just standing right here. We're not moving anywhere. How's your head?
My head is fine.
Feels okay?
More mental.
Smile for the camera.
He
You
wants-
got this. You're moving well, okay? Let's test your leg out a little bit. Can you take a side step towards me? Mm-hmm. And move the walker a little bit. Mm-hmm. Good. Alright, I think it's holding up pretty well. You think you can come over to the chair? So walker, surgery leg first. And then bring up your other one. Mm-hmm. Turn so you can sit in the chair. And then you can take a little step towards me so you're in the center of the chair. Okay. Step your surgery leg out in front of you a little bit. And then you're going to reach back for the chair and have a seat. There. How we managed to do that, I'm not quite sure.
Ooh.
Awesome.
That's it.
Mhm. And get the ball up to the.
Increasing
Got
my
it.
lung capacity.
Right. It is Friday morning. Chris spent his first night here. And I came back after Isaiah went to school this morning. And
Any other
of
home
course,
games?
stopped
That's a
by and got
money
me some
grab too,
breakfast.
man.
That breakfast was so good yesterday. I had to come back and get some more today. So
Mm-hmm. Oh, okay. Wow.
yum. He's in therapy today.
Hanging in there all right. You know the routine. Oh, okay. Your face too.
Oh my goodness. Don't do it.
Make it like you really want that.
For real.
I'm gonna let you do it.
That really hurts.
Is it sore hurt or is it sharp?
It's sore hurt. That's enough. That's enough.
You don't
For
want to do
real.
any more of that? Okay. Or I could call him. You put him in the system? Okay.
I already has his discharge papers done.
He's ready to go.
Okay.
Almost. He's got like 3 more reps.
Okay, when you come back, I'll give you your papers.
Okay.
Aren't you gonna want to take a nap?
You might want to take a nap.
What kind of car are you getting into today?
Oh,
Shame on my wife.
She brought the Ferrari.
Yep. This is maximum.
you
So-
want me to get the truck?
No.
So here's the key. So put the seat all the way back
Mm-hmm.
and then lower the seat backwards and get in. So
Okay.
you're gonna have more room
Okay.
to get your legs in, and then once you get in and situated, then you can put the back of the seat up.
Okay.
Okay.
It's time to go home.
How long were you guys here?
2 days. We've been here
Aw.
since Thursday.
Not too bad.
Yep.
Thursday was my birthday.
Yesterday was your birthday?
Thursday.
Thursday. Okay, happy belated
Thank
birthday.
Yes, it does. Some fresh air. Yeah.
It's real pretty out. Hey guys, we just got Chris home from the hospital. I am on my way to pick up his prescriptions. On the way home from the hospital, we dropped off his prescriptions. So by the time we, picked up my son after we left the hospital, we picked up my son, dropped off the prescription. They medicated him before we left, but he's in some pain right now. It's been about 4 hours, so it's time for him to get the medicine back in him. So I'm on my way to pick up the prescription. So duties as a wife, nurse, Uber driver, and everything else starts now. So I'll vlog as much as I can. See ya. Hey guys, I just wanted to come on real quick. I'm proud of myself, but I just wanted to tell you guys I gave my husband a shot tonight. I'm not showing myself because I look like umfufu, and I have on my, as my daughter calls it, my Clifford the Big Red Dog robe. So, but anyway, I gave him a shot, and it is of enoxaparin, sodium injection. And it's a blood thinner, so he has to be on blood thinners for 2 weeks and then start taking aspirin. So anyway, this was it. And I just had to do it before I knew it, guys, and I was able to do it. I was just so so proud of myself. I just thought I would never do anything like that. Even though I used to work at a hospital, I couldn't give shots, so. All right, it is Sunday morning, and I am cooking, trying to get, I'm trying to stay on a regular schedule here. It's 8:08. Isaiah's going to church this morning. I'm going to drop him off at church. Don't feel too comfortable about leaving Chris here for a long time. He's still not the steadiest on his walker and stuff. The home health nurse is coming, and so yeah, about to get some food in their bellies, and I'm still looking like umfufu this morning, so I'm not showing myself. But yeah, Chris had a little bit of a rough night last night. The Vicodin, I think, has bothered him. It makes him hallucinate. He said he had quite a few hallucinations during the middle of the night, so like people were after him, so probably call and see if we can either get the medicine changed or You know, do something, because I know that's a bad feeling. So, anyway, let me get finished cooking. I'm going to drop Isaiah off at church, and one of our church members is going to drop him off.
Now, here's the good news. I know you're in group 1 because you're here. Okay, so I get that. You've been more than
We're on our way to church this morning. I'm dropping Isaiah off, rather.
In many a picture in the hospital and people. Alright, let's grab your crutches. Let's practice with the crutches. I do want to do the steps also today.
It is day 7, and Chris is in therapy right now. Home therapy is day 7, so this is his progress.
This is what I was talking about. Don't leave it back. So, in other words, I have to come here every time, or I feel comfortable doing this now.
You can do it a little bit. It's fine. You just don't want it to
Be way back there?
extend it way back behind you. But you can.
So I can take baby steps, is
Yes,
what you're
that's
saying.
fine.
I like the crutches actually better on the steps. I like the crutches everywhere better, with the exception of getting into the shower.
Place to sit, those bleachers.
No, I won't. It's just too much
And
things.
being around other people.
I can't get out of the way of anybody.
Right,
Nah,
right.
well, when you're feeling better and more balanced, to still take something with you, because that way people are more aware of you. Let's go to the door and back.
Yeah, that's how I did the
Yeah, see, you're doing it. Yep, that's exactly how it would go.
Now this here makes me put more weight on that. You know,
Yes.
Which,
Yeah, because it's less support, so.
right. Making me concentrate. I'm thinking how to walk. Ain't that something?
Well, you look good.
Yeah. We walked outside we didn't go out yesterday, but we walked outside the day before. I had to get out.
Okay, so we just go back. Yeah, I mean, you're probably, I'd say many are better off and more comfortable doing this than laying flat in the bed still.
Yeah, this is where I slept better. I rested better down here. My back hurt so much more up there.
Laying in the bed.
So,
It'll get better. Give yourself another week and you'll be surprised at how much better you're feeling.
Okay.
Can't speed up the healing process.
And I have decided to, be good and not try to rush it back as fast as I want to get back. Yeah, I won't do it.
And you can't compare yourself to others' rehabs as well.
Right.
So I would try not to get in that mindset too, because you had mentioned your buddy and he was back on the basketball court doing, coaching, doing this after this many weeks. Everybody's rehab is different. Everybody's surgery is different. The damage that was done prior is something to take an effect too. If your hip was worse off, it's going to take you longer to rehab it. So, trying to. So post-op
Yeah,
was.
post-op.
Today's the 18th, so whatever that does. For EVAP wise.
Yeah.
What? 2, good. Keep 5 straight as you can the whole time. Good. 3. 4. 5 more. 6. 7. 8. 2 more. 9. Last one.
All right.
Two, you can. One more.
All right. No hollering like last time.
There you go.
Well, that was the second set too.
Yeah.
For the record, he already did 10 of
10
those.
set? Okay.
10. Already did 10.
I already did
Just
10.
for the record.
Good
That's
job.
it.
See, I gave you credit. You're like, oh, none. No, nobody more than us.
First time using a handicap sticker. Oh, let's hope it's the last. Oh my goodness. We're out and about at the eye doctor today. All right, it's time for the last injection. Been doing this for 14 days. This is number 14 of the blood thinner, enoxaparin. And yeah, my last shot, I think. And this is the injector needle. Okay, so we have to open the needle. That's the injector needle. So I put alcohol. You can use a cotton swab or whatever you have. And you wipe the site on the skin before you inject the medicine. Huh?
That's another one down too.
Yeah.
I had it on there. All the food gone.
So I thought I was taping before, but I had not pressed the video button. So we came in and I told him, don't run over nobody. And then somebody's right in front of him and he almost ran into him. But anyway, we went to therapy earlier today and Chris has been released to drive. It's day 18 or 19. And so he drove us to Sam's. We're at Sam's. And he drove here. The doctor released him to drive. So he's enjoying being out and being mobile.
Beef and cheddar.
Oh no, he ran into the curb. Got it? It's been a wild ride at Sam's.
Plug that back in for me, man. I like this guy. Thank you.
Oh, he getting gas too. Oh. All right, y'all. So I think I'm off Uber duty because Mr. is up and about, driving and going on, getting the gas and everything. He working it with that one crutch. So anyway, yeah, I'm off Uber duty. Hey guys, it is October the 29th. It's Sunday, and I'm here in the kitchen. But before I, start cooking or doing anything, I'm going to go up and interview my husband, see if he'll do an interview about the process, the surgery process, and the healing process, the recovery process for his hip replacement surgery that he had. So we can get this uploaded because this has been like a 2-month process basically doing this whole video. So I'm going to get his interview done and upload it. So hopefully I can get it uploaded today on October 29th. So see you guys. We're going to go upstairs and see if he'll do a little interview with me. All right, guys, this is my husband, Chris. And I'm just going to ask him a few questions about the surgery to give you an idea from his perspective as the patient, you know, things that you should be looking for, or, you know, just his outtake on surgery and the healing process. So the first question is, Mr. Being that this was a fairly major surgery, you know, hip replacement, did you have any concerns or fears leading up to the surgery?
Concerns or fears?
Mm-hmm.
I'll start with the concerns. Just how long it would take for me to get back to being able to officiate and really being able to run and move as freely. So that was the biggest concern that I had, and how long it would take for me. Mm-hmm. As far as fears, anytime you go through a major surgery, you know, you're going through the anesthesia. So that, you know, just going under, man, being put out, totally sleeping, mm-hmm. not being able to control,
right.
Have control of your faculties. So that would be an issue that I had.
Okay. And the second question I have for you is, was the surgery and the healing process, was it what you thought it would be?
As far as the surgery, on the lighter side, it was the best sleep I'd ever had because I really didn't remember anything. Mm-hmm. Recovery process, I'm still going through the recovery process. So with that, I would really just say it's slow, mm-hmm. a slow process, and it's really testing my patience because I'm one that's normally up, moving around a lot. So,
so it's just like a long recovery process, and you knew it was going to be a long one, but it's just being in it. It's just kind of tedious.
Right. Very much so.
Yeah. The third question is, what happened during the surgery and recovery process that you didn't expect? Like maybe at the hospital or...
Wow.
Mm-hmm.
I'm going to have to go deep on this one. Mm-hmm. I was so glad to find out that I had a catheter in me, and I was glad to find out that they put it in while I was under the anesthesia, so I did not feel it. Mm-hmm. Mm-hmm. But boy, when they took it out, they don't put you, no anesthesia, no
right.
local,
right.
nothing. Mm-hmm. They just tell you to take a deep breath and relax. Mm-hmm. And boy, when that young lady pulled that thing out, mm-hmm. I could have cried.
Yeah. Did the floor hear you? The rest of the floor hear you?
Yes. They heard me. They knew I was there.
I think one thing I didn't expect was them getting you up that day. I think they did mention it, but just the reality of it, because you were so out of it when they brought you up from surgery. I mean, you're just out of it. Mm-hmm. And the thought of them getting you up on your legs, knowing that the hip was just replaced, that was kind of nerve-wracking for me.
Yeah, they did tell us that they would do that. And mm-hmm. they said the same day, if your surgery was over by noon, that you would have physical therapy, that you would be up full weight bearing. Right. On that hip, so.
Yeah, and that was just, I that wasn't fun for me. I didn't like that part. Because it was just like 2 hours after...
Getting back from recovery.
And they were getting him up out of the bed, so... All right, and the last question would be, being that this is about the 7th or 8th week after surgery, what's your status as far as the healing process?
Obviously, I'm still in the healing process, but mm-hmm. I've passed a point of where the likelihood of it popping out is minimal. Mm-hmm. I'm past that point, which allows me to do more the physical therapy that's going to be more intense, where I'm lifting weights and actually testing the muscles and pushing the muscles to get stronger. Mm-hmm. So at that point, where I am now, I'm ahead of schedule. Mm-hmm. The good thing the doctor did tell me was that the good thing that I did prior to surgery was that I had arthritis in it, but I remained active, and that allowed my bones to be strong through the surgery, which also aids the healing process after the surgery. So whenever you get arthritis or muscle aches, if you can, just stay active, and that'll help your recovery process.
And the pain that you were having before the surgery, that pain is gone.
Absolutely. that pain is gone. The pain that I feel now is just building up the muscles to around my hip and in my hip. It's more muscle soreness than actual pain from the arthritis.
Okay. And then sometimes your hip still hurts where the rod has gone into your bone.
Right, but that's more soreness and your body getting used to having that rod in there, and just the muscles that are being affected by it. So, but that each day that I get stronger, and that's becoming less and less. That pain.
Okay. All right. Well, thank you. Do you have anything to add? Those are all the questions I have for you, but you do you have anything else to add?
To God be the glory for the things He has done.
That's right.
And I am so looking forward to getting back active and being able to move freely and uninhibited by this hip.
Right. All right.
Yeah.
Well, thank you so much. I appreciate your willingness to give the interview and tell the people, all the viewers, your experience and everything with the surgery, and hopefully that'll lessen some of their fears, knowing what to expect and everything. So thanks a lot.
You're very welcome, and you're the prettiest person to ever interview me.
Thank you. Him so funny. Well, I hope you got something from the interview. I hope you got something from this whole video. To answer questions that you may have about hip replacement surgery. If you have any more questions, please put them in the comments below, and I will, if they're direct questions for him, I'll ask him, and then I'll get back to you. But yeah, we'll be happy to answer any questions that we have, or any questions that you have that we can answer. So thanks so much for watching. Please, guys, and the reason why I did this video is so that people could, see what they were in for if someone out there needs a hip replacement surgery. Because, doing something like this, you want to see or talk to people who's been through it, see what the process actually is, the nitty gritty of it. So please share this to people that that may be getting hip replacement. Some people you don't even know are getting it, but it may hit somebody out there that you share it to, that they may know somebody or they're getting it, because there's people in our church that are getting it, and just people that we know. And it's like you get to talking, and he's like, "You've had hip replacement, or you're going to have it," and then they ask more questions and stuff like that. So if something is available for people to see, I just always think it's good to help people. When they're facing something, if they see a real person going through it, then that helps them. So please share the video. All right, guys, take care, and I'll see you next time on Tracy's Podcast.